Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. The research study I'm citing today was published in the Journal of Clinical Oncology in 2015. It showed that regular consumption of caffeinated coffee may help prevent the return of colon cancer after treatment and improve the chances of a cure. The study included nearly 1,000 colon cancer patients who filled out dietary questionnaires early in the study, during chemotherapy, and again about a year later. The patients who drank 4 cups of caffeinated coffee per day on average after being treated with surgery and chemotherapy for stage 3 colon cancer showed the lowest recurrence rate of colon cancer, metastasis, or dying from any cause. So that's about 460 milligrams per day of caffeine. It's an important finding as stage 3 colon cancer involves spread of cancer to the lymph nodes near the primary site of the cancer, which is a bad sign. Now, non-caffeinated coffee did not seem to offer any protection, so it appears that caffeine itself had the protective properties. So the results showed that stage 3 colon cancer patients consuming 4 or more cups of caffeinated coffee per day after standard medical treatment for colon cancer were 42% less likely to have the cancer return than non-coffee drinkers, and were 33% less likely to die from cancer or any other cause. 2 to 3 cups of coffee per day had a modest effect, while little protection was offered by having 1 cup of coffee a day or less on average. The study is important because most recurrences of colon cancer happen within the first 5 years of treatment, and then it's uncommon for it to come back after 5 years. So those first 5 years are critical. This study lends support to a growing number of recent studies suggesting that coffee may have protective effects against the development of several kinds of cancer, including not only colon cancer, but postmenopausal breast cancer, melanoma, liver cancer, and advanced prostate cancer. As the researchers explained, in this instance, the lowered risk of cancer recurrence and deaths was entirely due to caffeine and not other compounds found in coffee. So how might caffeine reduce cancer risk and cancer recurrence? Well, caffeine is known to increase insulin sensitivity, thus lowering the amount of insulin required by the body after a meal. And lower insulin levels are linked to reduced risk of many cancers and linked to reduced cancer recurrence right across the board. In addition, some experimental studies have shown that caffeine enhances the tumor-killing effect of some chemotherapy drugs, and that it may also induce programmed cell death of emerging cancer cells and decrease cancer cell replication. Coffee and caffeine, once classified as potential carcinogens, meaning they were classified as agents that might actually increase risk of cancer, are now being reclassified as cancer fighters in the wake of many recent cancer studies. So if you like a cup of coffee and you're not sensitive to the caffeine, then it may be wise to have 2 to 4 cups per day. And if you are a colon cancer survivor, talk to your doctor about the value of having 4 or more cups of caffeinated coffee each day, and possibly share the research cited below with your doctor and oncologist to get their feedback. Okay, thanks for watching, and I'll see you next time.